Health, and thank you all for being here this evening. I'm happy to have the opportunity to talk to you all about breast health. So I'm sure many of us in this room know someone who's been affected by breast cancer. It's very common. It's the number one cause of cancer in women, and 1 in 36 women will die of breast cancer. So unfortunately, a very common disease, and most women actually do not have any identifiable risk factors. So breast cancer mortality has decreased approximately 30% since 1990, and this is in part due to screening mammography as well as advances in breast cancer treatment. So there are a myriad of risk factors for breast cancer, and we won't talk about all of these in detail, but we should be focusing on things that can be modified. A lot of these cannot be modified. We can't really change our genetics, as Dr. Dupree mentioned. We can't change the breast density that we are born with, but we can have some effect on some of the other risk factors, such as maintaining a healthy weight, alcohol use, certain hormone replacement therapies, and possibly tobacco use. The jury is still out on that, but some of these risk factors are modifiable, and we can talk about those in more detail in our breakout session. So things that you'll probably hear over and over tonight from each physician, things that you can do to stay healthy and reduce your risk of pretty much every disease that we're touching on this evening, would be maintaining a healthy weight and exercising. And of course that sounds so simple, but obviously very challenging to do with the busy lives that people lead and things like that. But certainly these are things that you can do to decrease your breast cancer risk. Breastfeeding has been associated with a decreased risk of breast cancer as well, limiting alcohol consumption and limiting certain types of hormone replacement therapy, and that would be something you could talk about more with Dr. Burkholz and Dr. Dupree too. One of the areas that we look at with breast cancer risk is family history. It's something that's not modifiable, but when you're trying to reduce your risk and increase your chances of catching a cancer early, it's good to know what your family history is and whether or not you are considered to have an elevated risk. And so these are some of the things that you could look at in a family history to determine whether a woman has an elevated risk of breast cancer or not. For example, having 2 or more first-degree relatives, so a mother, a sister, a daughter with breast cancer, or having a first-degree relative, such as a mother or sister, that has had breast cancer diagnosed at an early age, family history of breast and ovarian cancer, a male relative with breast cancer. Those are some of the things that we look at when we're looking at whether or not a patient is at increased risk based on their family history. So for these women that may be at elevated risk, they may or may not have an actual breast cancer gene. Most people don't have these breast cancer genes. If they have a family history, they may not have any actual determined genetic element, but there are still familial cancers out there that may not have that gene that has been determined yet. So some of these women may qualify for a more intensive screening regimen. For example, in addition to mammography, they may qualify for breast MRI, which is another very sensitive way to look for breast cancer and is now recommended by the American Cancer Society for screening as well for these high-risk patients. And there are other ways that women at high risk of breast cancer can reduce their risk. So screening mammography does not prevent breast cancer. However, it does increase the likelihood that if a cancer does occur, that it will be caught at an earlier stage. And we know it's important to catch breast cancer at an early stage because they are easier to treat. And so we like to pick things up before they're something like this. This is a mass on a mammogram and on a breast ultrasound here. And this woman had a palpable mass, so she had not had a mammogram in several years and detected a lump that she could feel. So unfortunately it was detected a little bit later than hopefully, than we would like to catch. So we like to catch cancers very early on screening mammography. So the goal to detect cancers before they become clinically apparent, when they're easier to treat, and this is mainly because the prognosis for patients is directly related to the stage at which they're diagnosed. So breast cancers that are found because they're causing symptoms, such as a lump, are typically larger and more likely to have spread beyond the breast versus breast cancers that are found by screening mammography. They tend to be smaller and are less likely to have spread beyond the breast. And these are the American Cancer Society screening guidelines, and we can go over these in more detail in our breakout session. But for women age 40 and over, the American Cancer Society recommends annual mammography, annual clinical breast exam, and they would talk about breast awareness, which I'll touch on a little bit here in a moment, and then monthly self-breast exams are sort of considered optional, and we'll talk about that a little bit more. And for women at high risk, which we talked about a little bit, those women that are at greater than 20% lifetime risk, it's recommended to consider an annual breast MRI in addition to mammography. So breast awareness is something that the American Cancer Society really recommends now beyond doing the breast exam. And basically this is just kind of having a general idea of what your breasts normally look and feel like. Some women are very intimidated by the prospect of having to do a monthly breast exam and having to do it in a certain way, and what's the proper technique, and rather than just not doing anything at all, it's important to at least know in general what's normal for you. And mainly this is just so that you can detect changes as soon as they occur. So some of the common symptoms for breast cancer would be a lump or thickening in the breast, changes in the skin such as redness, scaling, what we call orange peel skin, nipple changes, or swelling under the arm. Those are all things to look for. Now, mind you, these things don't always indicate a cancer. There are many things that can cause lumps and bumps in the breast tissue, but it's always important to get any changes checked out by your doctor. So part of breast awareness is also knowing your risk factors for breast cancer and know what the screening recommendations are for you. And most importantly, report any of these changes to your doctor right away. We want to pick up cancers when they're small, like this one is, and this is much smaller than the cancer that we saw in the previous case. So this is something that would be easily detected during a breast exam. It's right under, this is the skin surface. This is something that we can look for on some of the breast models I have in the breakout session, and we'll talk about how you can do an exam to be able to find these types of lumps in your breast. And I'll also have these websites available for you for more information.